In this communication, again discuss a recall communication. It is come on 2022 September, India. Okay. The communication is the diabetes mellitus with celiac disease. Explain the celiac biopsy result. So it is an information giving plus a breaking bad news. Okay. So as usual, we are introducing myself, IRCP, introducing myself, then repo making, taking the consent, agenda telling, attendance, and prior knowledge. So remember, follow up with the dietitian, GP, general pediatrician, and gastroenterologist. Now, I'm really sorry to tell you that the test run for Ali came back positive for a case called celiac disease. Then give a pause because it's a breaking bad news. Have you heard about it before? No, what is this? So it is a disease affecting his gut. Can you please follow me at this drawing to make myself clear? So we draw a picture of defense system. Then we said that the protein is entering the gut. That type of picture we'll draw. So explanation, when Ali eats the protein called gluten, which present mainly in wheat and barley, it stimulates the defense system. Normally our defense system acts as a soldier against the germs and bugs. But in this celiac disease, after being stimulated by this protein, it will attack the gut itself, leads to destruction of the inner layer. So Ali cannot be able to absorb the nutritive elements of the food and he will have diarrhea. So I'm telling that when normally what happened, when Ali eats this protein it affect mainly the wheat and barley. It's present. This protein is called gluten. It stimulate our defense system. Normally our defense system act as a barrier soldier against the germs and bugs. But in celiac disease, what happened? It is stimulated by this protein. It will attack itself own and destruction of the inner layer. So Ali cannot able to absorb this nutritive element. That is gluten containing food and causes the diarrhea. OMG doctor, is there any treatment for this? Unfortunately, there is no any medical treatment, but the best treatment is prevention. Do you have agree with me? Then the mother is asking, what do you mean by preventive treatment? By preventing Ali from eating this protein while giving a chance for the inner layer to the gut to build up itself again, and this diarrhea will be stopped, and Ali will be absorbed to absorb the nutrients from the food. So unfortunately, prevention is the treatment. He will avoid this gluten containing protein. And the mother is asking, okay, doctor, but for how long you will stop eating this protein? Unfortunately, it is for the lifelong. Say with sad voice. Sad voice. Okay. The mother telling, OMG doctor, do you imagine what will be happen to the baby? How can he eat the cakes and sandwiches? I'm really understand how do you feel. And I can understand it is really difficult. But now in this era, we have many products gluten free and almost same taste as normal food. For that, we will have a meeting with the diet doctor who will teach you exactly what should eat and what should avoid. And I can reassure you there are a lot of alternatives. Could rye, oats, and barley replaced by corn flour, rice, potato, lentil soup, pure maize. Are you with me? So mother is very much worried. Then we will tell that I understand your feelings. It's really difficult, but now this era there are many products that are gluten free, contain almost the same taste available, and we'll make a meeting with the diet doctor. He will teach you what exactly should eat, what should be avoid. He'll give a list. We'll reassure him there are a lot of alternative is present. Now mother asking, okay doctor, I think it is very difficult to do these foods at home. Getting it from outside is so expensive for me. So we will discuss it with the social service to get a solve without any burden on your economic status. Okay. Also, we'll need to check him up every year at least to make sure he is sticking to his diet to measure his weight and height. Am I making self clear? So every day you can follow up at least that he is taking this diet properly, his height and weight growth is going good also. And our patient is already diabetic patient. So also in some children, not all children, they may have increased risk of some diseases caused by defense system in Ali's body like diabetes and thyroid affections pointing to your neck. For that, we need to measure the blood sugar and test for the thyroid function test every now and then. Am I clear? So he is diabetic. So diabetes patient has a close relation with the celiac disease. We'll tell that. So we need to monitor the RBS level and also thyroid function test because thyroid also there is a chance of development. We should need to check them. Okay, clear. Is it? It is running in genes. Actually, it is not running in genes, but tend to be clustered in families, and that is why we need to check his brother and sisters. So this is, and at the end, do you have any other concern? Always we want to know the hidden agenda and trusted website, written leaflet, support group, diet doctors meeting. So this is all about the celiac disease communication, which is CAM 2022 India. Task was diabetes mellitus with celiac. Explain the celiac biopsy results and answer all the questions. Thank you.